This legislation that the Republicans are considering, however, eviscerates Medicaid, the very program that funds the care provided to 3 out of 4 residents here in Hamilton Plaza. It's really quite simple. Republicans changed the guarantee that Medicaid is. Under the law as it exists now, we call it an entitlement. It's a guarantee. It says if you meet certain criteria, whether that's about disability, long-term care needs, whether that is a pregnant mother who has no other source of health care, whether that is a special ed child in school, whether you are poor, all of those individuals qualify for Medicaid, and they have a guarantee. Under the Republican bill, that guarantee is gone.
My brother, Gerard Nolting. Gerard is, in addition to being legally blind, he's autistic. He has developed hearing problems as he's gotten older. He has great difficulty with motor control, and he's in a wheelchair. My family knows that Gerard is safe and well taken care of because of Medicaid. And if Gerard and 15 million or more other people are thrown off Medicaid, I don't know what will happen. I am hoping and praying that the Republican plan is not enacted for the sake of my brother Gerard.
And these brutal cuts couldn't come at a worse time. We all know that Americans are getting older. We face what some call a silver tsunami, with nearly 10,000 baby boomers turning 65 every day. Republicans like to paint Medicaid as a program that is full of able-bodied adults who choose not to work. But nothing could be further from the truth. The facts tell a very different story. The reality is that nearly half of all Americans over the age of 65 will require long-term care at some point in their lives. And Medicaid pays for 3/5 of all long-term care in the United States. 3/5, 60%.
Before I came here, I had a very serious illness, and I mean a very serious, life-threatening illness that required hospitalization actually for months. And I only have, my husband is dead, my son lives out in the Midwest, so the only person I had really to help me with the expenses is my only daughter. And the expenses were into the thousands because I had major surgery, and of course that included anesthesia and all the rest of it. It turned out that the hospital bills were over $1,000, and I didn't have that kind of money. Actually, I was an RN. I worked as a nurse all of my life, and I've seen other people go through this and been very worried, very upset, wondering how they were going to pay for their hospital bills. And this is where Medicaid comes in. It is such a help to those like myself who need assistance and who have spent all their lives taking care of sick people and have seen this actually, come to pass, that people have been very worried during their illnesses as to how they were going to pay for the bills. And I could very much sympathize with them because I went through it myself. And so Medicaid is a wonderful, wonderful program. And if it was discontinued or changed, I am one who would be very much affected. My whole life would be affected.
The notion that Republicans can slash Medicaid by more than $700 billion without causing real harm to our communities is downright misleading. And their claim that these cuts are about giving states more flexibility, more choice over how to run Medicaid is preposterous. Because as far as I can tell, the only choices that the Republican plan leaves New Jersey are very bad ones. Do we shutter nursing homes and long-term care facilities, leaving seniors and the severely disabled without a roof over their heads? We can't let this happen. We can't afford this bill because this issue really hits home for me. I watched as my mother blazed Alzheimer's for years before she finally passed away. It was a long and heartbreaking goodbye. There was only so much my sister and I could do for her, but it was Medicaid that kept her alive. It was Medicaid that covered her care in addition to what my sister and I afforded her. And she lived with my sister because culturally that's what we wanted to do. But it was a struggle. She had family. She had a son. She was getting through medical school. I had 2 kids. I was getting through college. And these are the intergenerational challenges that we face. Being able to give mom or dad the dignity that they deserve in the twilight of their life, and at the same time being able to take care of our kids and giving them the opportunity at the beginnings of their lives. These are real challenges that families face along the way. My family story is not unlike many of those here today. It's hard to find anyone who hasn't had a loved one depend on long-term care at some point in their lives.
My name is Lura Savona, and I'm a caregiver for my mother, Aileen Nilsson. Here she is. Today is her birthday. She's 81, and she will be spending the rest of her life suffering from Alzheimer's. We had spent over $600,000. And I just want you to know I'm one of 7 children. That is a lot of money that was saved for my parents' retirement. My father would never see it, and my mother honestly doesn't even know about it. At this point, it was clear that my mom needed a nursing home. And luckily for me, I was able to find a facility in Passaic County that required little money and that we had left to give to them to have my mother move in and get the care that she needed. We would have to be 1 salary short as a family, or one extra person more to feed and care for in my house if we didn't have Medicaid. If we didn't have them there for us, my mother would be living with me, which would mean I couldn't go to work anymore because she needs round-the-clock care. And at this point, there is no money left, and we only have Medicaid to look forward to. It comes when they no longer can receive physical care from their families, or they've exhausted their savings accounts, paying for their well-being, health care, and their safety. And then they become desolate in the process, and they have no other alternative.
And how we care for elders and treat the most vulnerable defines who we are as a people. I do not believe that this Republican plan reflects the values of our nation as Americans. It's personal for me. It should be personal for all of us. We have to honor the promise that in America, a lifetime of hard work translates into a retirement with dignity for all. We are not a callous country with no regard for neighbors. Americans are better than that. Now, at the end of the day, the latest version of this health care bill is like a splash of cologne on a skunk. It still stinks. It still ends the federal guarantee that patients with pre-existing conditions, that guarantee is gone under their bill. It still forces consumers into bare-bones plans that fail to cover essential health benefits that families count on, like hospital stays, visits to specialists, prescription drugs, prenatal care, and more. It is not freedom, as Senator Cruz suggests. It is not freedom to buy junk insurance and then when you get sick, find out that you got absolutely nothing to cover you when you need it. Freedom is to be able to know that if I get sick, I have the coverage at the end of the day that will help me get healthy again. That's freedom. It fails to adequately fund our ongoing battle against the opioid epidemic while denying those struggling with addiction access to the comprehensive physical and mental health care services they deserve. It shouldn't be too much to ask that a new health care law would actually improve health care. But for most of my life, I have learned that moving forward doesn't start by going backwards. And that's, in essence, what this bill does. It takes us back to a time and place that ultimately we cannot be. We stand ready, and I say we, Democrats in the Senate. I helped write the Affordable Care Act as a member of the Senate Finance Committee, which I still am a member of. We have tried on several occasions, recognizing that the law is not perfect and there are things that we can do better. But every time we have wanted to try to open up the patient to heal it, our colleagues want to slave it. That's not the way we're going to move. We need to end this ideological view that we have to end the Affordable Care Act and then get into a bipartisan way to improve our health care system. We can do that. And that's what America expects, and that's what we should deliver.